Hello everyone. Today we will talk about heart attack, which is also called myocardial infarction. It is injury to the heart muscles due to decreased blood flow. Now we all know that every cell in our body needs oxygen, and oxygen is carried by the blood. Whenever there is decrease or restriction of the blood flow to any part of the body, that part dies. The same happens in myocardial infarction. To the heart muscles, the blood is supplied by the coronary arteries, which you can see here. This is the right coronary artery and this is the left one. These arteries arise from the aorta. Now, if you look here, there's restriction of the blood flow due to cholesterol deposition, which is also called atherosclerosis. It's a condition which also happens in coronary artery disease. We will talk more in detail about this condition in a separate video. As we can see here, there is restriction of the blood flow to the heart muscles, due to which the heart muscle is unable to function, and it results in necrosis or death. Now, there are two types of heart attack. First one is illustrated here. As we can see here, it's an atherosclerotic plaque here and coronary artery. Whenever this atherosclerotic plaque rupture, fissured, or there is erosion of the plaque, then a process gets activated called thrombosis, which is simply for blood clot formation. So whenever there is blood clot formation, it results in occlusion of the coronary artery and there is restriction of the blood flow again. So this is progression of the coronary artery disease leading to heart attack. So the next type of heart attack is due to oxygen supply and demand mismatch. It usually happens in those who have a very low blood pressure or hypertension due to blood loss and an injury or due to volume loss. And the other one is anemia. Anemia when there is decreased red blood cell production. As we know that red blood cell carries oxygen, so decreased red blood cell automatically leads to low oxygen supply to the heart muscles, and it results in necrosis or myocardial infarction. We're going to talk about incidence now. So it is interesting as the data shows that there are 1 million cases in the United States each year of heart attack. That means that every 40 seconds there's a patient who suffers from myocardial infarction. We're going to talk about some of the causes now. The first one here is embolism. Embolism means whenever there is detachment of a tiny clot from a plaque anywhere else in the body and goes into the coronary arteries here and blocks the blood supply. The next one is vasospasm. Vasospasm means there constriction of the coronary arteries, which again reduces the blood supply, results in death of the heart muscles. The other one is non-atherosclerotic coronary dissection, which happens in trauma, which causes dissection of the coronary arteries. The other one is atherosclerosis. We talked a little bit about it, but we're going to talk more about it in another video, as this is very important. And the other one is decreased oxygen supply. So here we're going to talk a little bit about the pathophysiology of the heart attack. So what happens during a heart attack is you can see that there is complete occlusion of the coronary arteries here. Complete occlusion means there is not a tiny bit of blood flow to the heart muscle. All of the layers are affected here. This is also called ST elevation myocardial infarction. ST elevation, here we can see this is an ST segment. So it gets elevated. It gets elevated here and complete occlusion of the coronary artery. Other one is subendocardial infarct, which happens whenever there is partial occlusion of the coronary artery. It results in ST segment depression myocardial infarction. So as we can see that inner layer of the heart muscle is affected. but the outer layer is completely fine. So how does it happen? So let's suppose it's a coronary artery and it supplies blood flow in this direction from outside to inside. So when oxygen is carried from outside to inside, so the heart muscle that are outside is supplied by the oxygen, and the oxygen is taken by this part of the muscle, while there is not enough oxygen going inside to the heart, to the inner part of the heart muscle. So that's why it is usually affected and oxygen supply demand mismatch. So let's discuss some symptoms of the heart attack. So during heart attack, the person feels some sort of typical features, which is also called the cardinal symptoms. The first one is diaphoresis. It is diaphoresis, sense of impending doom, restlessness, nausea, vomiting. Patient can also feel dyspnea. There is retrosternal chest pain that is radiating to the left side of the body. So whenever a person who is suffering from a heart attack, they usually say that an elephant is sitting on their chest. That means that there is a heavy pressure, that there is a belt around their chest and someone is squeezing the belt. Unspecific warning signs, especially in women. There's dizziness, lightheadedness, syncope, fatigue, exhaustion. That means that they feel like they have run a marathon. Jaw, neck pain, upper back pain, palpitation, epigastric discomfort, pressure. So whenever a patient arrives with a heart attack symptoms, so the first thing that is performed is ECG. So ECG is gonna tell you whether they are having a heart attack or not. And MRI or blood test can also be performed. But the most important one I want to mention is angiogram, coronary angiogram, which is super important because you can tell which artery is blocked and how much it is blocked through coronary angiogram. So what happens in an angiogram is there's a catheter is passed either an artery in the arm or in the leg. This catheter is inserted into the aorta and into the coronary artery. And while it is in the coronary artery, a dye is injected here, which tells you how much the artery is blocked here. Example of angiogram right here. And we can see that this artery right here, it is blocked here. We can see that this artery right here is blocked here. And the dye doesn't go ahead in this artery right here. And in the next picture, we can see that it has been opened via the catheter here. So there is restoration of the blood here. So coronary angiogram is both diagnostic and therapeutic. So what it means that it can diagnose, it can tell you which artery and how much is blocked. It is also therapeutic. To a placement of a stent or balloon angioplasty, it can open up the blocked artery. Now let's talk about the treatment now. So right here you can see that a stent is placed here. So left coronary artery that it was blocked here, and here you can see this artery is blocked, and through the placement of a stent here, the balloon is inflated and a stent is placed, and there is opening of the blood vessel and restoration of the blood. So it is extremely important that you have to revascularize the heart muscles within 90 minutes. Because if the revascularization occurs within 90 minutes, it increases the mortality, increases the survival rate of the patients. Antiplatelets and anticoagulants are also given to the patients, which actually decrease the formation of the blood clot here. As we discussed already, there is a blood clot formation and occlusion of the artery. So antiplatelets and anticoagulants decreases the blood clot formation. So an adjunctive therapy. Oxygen can also be given to the patient whoever are in distress. Nitrates are given for the pain. Morphine is also another option if the pain is not reduced with the nitrate. Beta blocker is given to decrease heart rate, for the heart to be filled with the blood and to open up the coronary arteries. ACE inhibitors are given in diabetes mellitus patients, and statin is important too. It stabilizes the atherosclerotic plaque inside the coronary artery by stabilizing the atherosclerotic plaque within the coronary artery. The blood clot is not formed and there is no occlusion of the coronary artery. So that is why statin is very important here. Alright, thank you so much for watching. And if you have any questions, just let me know in the comment. I will be happy to answer. And good luck and wait for other videos. I'll be uploading very soon. Thank you.